Hello, my name is Dr. Shoaib. I am the DMO at the Motinagar Center. Today I am going to explain you about the crash card. What is crash card? Crash card is a mobile card which used inside the hospital at the time of life-threatening emergencies like cardiac arrest or any other medical emergencies. Objective: it defies a process to handle emergency situations. Ease of accessibility to emergency drugs and equipments. Ease of tracking the availability of emergency drugs and equipments. Sections in crash card. There is a universal set format for the crash card, but any other health care organization can modify it accordingly to their scope of service. Sections divided in crash card used in our organization: top shelf, front boxes, front slab, 6 drawers, bottom shelf, and oxygen cylinder. Top shelf. Top shelf consists of 4 items, which is ambu bag, oxygen tubing, face mask, and vein circuit. Front boxes. We have 6 front boxes in this: injection atropine, injection adrenaline, injection avil, injection efcorlin, injection soda bicarb, and injection codron. Front slab. Front slab we have defib, ECG jelly, ECG electrodes, and ECG cables. Drawers. We have 6 drawers, in which drawers A for emergency medicines, drawers B for ET tubes and catheters, drawers C for oxygen mask, cannula and suction catheters, drawers D for emergency medicines, drawers E for syringes, IV cannulas, needles, 3-way stopcock, and drawers F for intubation equipments. Bottom shelf. We have gloves, examination and surgical, cap and mask. Oxygen cylinder. It should be filled, it should be with the flow meter, and it should be checked daily, and the water in the flow meter should be changed daily, and filling date should be mentioned on the daily basis. Additional points: it should be checked on the daily basis by nursing staff, and all the medicines should be replaced before 60 days of expiry. It should be always covered and sealed. If the unit has central line supply for medical gases, then also it is mandatory to have an extra oxygen cylinder in the crash card. Thanks for watching this video. If you have any queries related to this video, please contact our clinical team.